Health Minister Dr Aaron Motsoaledi has just concluded a media briefing alongside provincial MECs on various health issues. He announced the approval of 1,200 jobs for doctors, 200 nurses and 250 other healthcare professionals. The minister also said a team has been appointed to review a number of health policies. Ziniko Mhlaba was there and joins us live from Centurion. Quite a number of areas that the minister touched on, Ziniko, during that briefing.
Well, a very telling briefing indeed, Pravio, if I may say, looking at the decisions which were announced by the panel led by Dr. Motsoaledi, the minister himself, when we talk about issues of reviewing policies that are currently existing in South Africa, but also giving an update on the issue of the NHI and where things are at this point, but also the general state, whether you're talking about issues of safety of healthcare workers in South Africa, especially in Limpopo, many other things. But what is also telling from that is the make of the team or the committee which will be tasked with reviewing those policies that are relating to human resources matters within the Department of Health. But to get more details now and clarity on some of these matters, I'm joined by the Minister himself, Dr. Aaron Motsoaledi. Minister, thank you very much for your time. Looking at the announcement you made, one of the things that came out was the issue of having money available or at least set aside to address some of the challenges, whether we're talking about unemployment of doctors, but also the issue of purchasing much needed resources within the public sector. Are you happy with the money that has been allocated to your department by the finance minister? And how did you get to a point where you got satisfied as this council to say, well, this is what we need to work with, or would you have loved to get more money?
Well, obviously we'll be much happier if we got more, but this is what we had, and we have to work with whatever we had, and we looked at the money given to us. Our starting point was this. There's been austerity measures which took place over a period of a decade in health, where health budgets were cut. That's why we arrived where we are today, where we could not even hire doctors who have qualified. It's because of something that has been happening over a period of 10 years. Now we are happy. Where we are very happy is that Treasury agreed that this austerity is not good for health. It's not good for health, and we need to start a process to reverse it. Now that reversal can't happen in one budget. That's impossible. Something that happened over a period of 10 years. So this was just the beginning. And we looked at this beginning, what we have got in the kit, and say with what we have, what impetus, what impact can we make to the public healthcare system? That's why we said we'll make an impact, firstly, on the appointment of healthcare workers, especially doctors, for obvious reasons, which you all know. But we also looked at some of the reports that have been emanating from our public hospital. A shortage of beds, a shortage of linen, and people not being able to go to theater because there's no linen, there's no mattress, people sleeping on the floor. We said we needed to resolve that. And when we went from province to province, we started, by the way, in October last year. Only that we got the money now. We've been working on this thing from October last year and looking at what we can do to our hospitals, and we found that we needed 1.4 million articles. That is beds, mattresses, bassinets for babies, linen, sheets, blankets, and all that. And so that's why we say let's buy them now, and they'll cost us 1.3 billion rand and supply them to our hospitals.
Let's get to the issue of the NHI, Minister. You mentioned during the briefing that there are some challenges in terms of getting off the ground when it comes to implementation. You mentioned some of those issues being legal issues the department has to deal with. But do you think politically you have enough support to really go through with the NHI in its current state? Or have you looked at these concerns and said maybe we need to really relook some of the issues we have currently in this NHI?
Well, it all depends what is your meaning of politically, or who must give that support politically.
So, okay.
Yes, who must give that support politically? At the moment, there are court cases which we are dealing with, and there are 5 of them. We just had the 6th one was added maybe late last week, but or early this week. We are responding to them, and we are answering. Obviously, the matter is in the hands of the judges, but at the political level, it's very, very unfair for people in the media, because most people that oppose NHI are people who are benefiting from the present system, which benefits only the elite. That includes even myself, people who have got titles, people who are working, ordinary people who are not benefiting from this, do not know much about NHI, but they've never said they are opposing it. When we go to them and explain, they understand. And I've been holding a lot of meetings for which I received a lot of flack. Why I'm going out, why we're advertising NHI and all that. We want people to know, because there is a belief that NHI is a madness of South Africa. The whole concept of universal health coverage, universal means all, rich and poor. And a situation in South Africa where you look at the poor and say, those ones can wait, there's no money, will only be able to cater for the rich. It's immoral. It's very, very immoral. And I don't think it goes in terms of our constitution. If you look at our constitution, it's all inclusive. That we must make sure that people are equal before the law, and we include them and give them healthcare services. Lastly, I always tell those people who are against NHI that if we did not treat everybody equally when we fought HIV and AIDS from 2010, when we launched the world's biggest HIV counseling, testing and treatment campaign, if we excluded people on the basis of money, I can assure you with my eyes closed, the economy of this country will have collapsed. Do you remember how many people used to get sick, absent from school, in both education, health, and in industry? And we said everyone, regardless of their socioeconomic status, must be tested, cancelled, and be treated. That's why we've got 5.5 million people. If we looked at money and say, no, this one can't pay, this one doesn't have a job, this one doesn't have medical aid, we wouldn't have been where we are today.
Minister, thank you very much for your time. We ran out of time, unfortunately, but thank you very much for those insights in terms of the briefing that the Minister had together with the MECs of Health from all the 9 provinces. So the meeting continues, as the Minister said, that at least up until tomorrow. That's where maybe they'll be available for conclusive outcomes of this engagement that has taken place here in Johannesburg. It's back to you in Studio Provincial for now.